Today we have with us Dr. Arbinder Singal, pediatric urologist. He is well known in his field for repairing hypospadias. So what are hypospadias? Here is what Dr. Arbinder Singal has to say about this condition.
Hypospadias is a condition where the urinary opening is not at the tip of penis but somewhere on the underside. Sometimes it's near the tip of the penis but on the underside. Sometimes it can be as far back as the anus or even in the middle of the testis. This is a condition which has become fairly common in the recent 3 decades. Probably it is because of the male hormone blockers which are present so much in the environment these days, resulting from all the chemicals which we use, all the dyes, hair colors, car perfumes, you name it, dyeing agents, coloring agents, everything gets broken down into female hormones. And these female hormones ultimately go down and block the male hormone receptors when the baby is developing, leading to hypospadias. Chemicals like pesticides, fertilizers, or even infertility treatment which use a lot of hormonal chemicals can lead to higher incidence of hypospadias in the children. Hypospadias as a clinical condition is very easy to identify, and it's mostly diagnosed as soon as the child is born because the penis is abnormal, and this is nowadays a routine part of the clinical examination in the newborn age. These children will always need surgery, and this surgery is typically done at 6 to 9 months of age. If it's a simple hypospadias, it can be a daycare surgery where the child comes to the hospital in the morning, gets the surgery done, goes home in the evening. While for severe hypospadias, it may be a 2 or a 3-stage surgery which is done at intervals of 6 months and may require the child to stay in the hospital for 1 or 2 days. If the child has a severe hypospadias associated with bending of the penis, then it can be a physical limitation for performing the sexual act, leading to difficulty in having children. So hypospadias should always be repaired, and the ideal age to repair it is around 6 to 9 months of age. Circumcision forms a part of the hypospadias repair itself, because the excessive foreskin which is there on the top of the penis is used for making the new urinary passage. Hypospadias is a very common condition. It occurs in 1 out of 147 boys at the last incidence count, which means in India every year 85,000 kids are born with hypospadias. So, and plus combined with a lot of other children who have not been repaired adequately, I get to see sometimes young men with ages of 25 years, 30 years, 35 years coming for hypospadias repairs. These children, these adults have typically undergone multiple surgeries in the childhood which have failed, and they've lost all hope. Last month we treated a boy from Nasik who had undergone 6 surgeries in childhood, and parents were told the repair is just not possible. It took us about 8 hours, but we repaired everything in single stage. So now with the advance of new technology, new types of sutures, better training of the surgeons in this field, every kind of hypospadias can be repaired, and these children can have a normal sexual life after that. Children who have had a successful repair of hypospadias can conceive a normal child, are fertile, and can lead a normal sexual life which can be socially productive, just like a normal child. Children who have undergone an intersex management treatment, whether it's surgical or hormonal, some of them may be infertile and may need assisted means of reproduction.